Ledyard National Bank presents this special segment. Ledyard National Bank wants to congratulate Bruce King on the wonderful career serving his community. They thank him for his continued guidance and leadership as an integral member of Ledyard's Board of Directors.
I'm Laura James for YCN, and we are speaking to Bruce King, who is President and CEO of New London Hospital. Welcome back, Bruce.
Thank you.
Yeah,
Thank you.
It's so good to have you here. Now, we've been speaking in earlier segments about our connection to the New London community.
Right.
And we have had a lot of folks in our local community who've been a part of your whole hospital experience.
Absolutely. I've had the benefit of having a terrific board. Starting with, Bill Helm was the original board chair that actually interviewed me when I was nominated.
I never knew that.
Yeah,
oh, wow.
J.D. Colcord and Bill Helm. I met him on Main Street in spring of 03 and passed the test. I was the recommended person we talked about earlier from Dartmouth-Hitchcock. But I've had terrific board chairs. Dudley Smith, Ian Holmes, Sue Reeves was a longtime chair, still on our board. She switched hats because she went to, back to Dartmouth-Hitchcock. Currently Doug Lyon. So, just a terrific community board, pillars of the community who are passionate and supportive of the hospital and are very demanding of management in terms of, more, better, faster. And that's the kind of board I'd like to be working with.
Yeah, more, better, faster, exactly. And that really is how it felt as you came in.
For me too,
I think you were
which
running
is why I'm running to retirement.
Oh my goodness, but it's true. I mean, as you say those names, we're also picturing them, walking in the New London Hospital Day Parade, serving us, during the barbecues, attending the art shows that you've had.
And many of them, if you think about it, not only are supportive of the hospital, they're supportive of the college, they're supportive of the Osborne Sargent, they're supportive, the community resources. This is really, I've come to learn, a wonderful community and passionately supportive of their local institutions.
It is, and it trickles down because we have from everyone from our board chairs to members, and then we have just the people in the community who are always right there.
Correct.
Getting their trucks together and for the parade.
I didn't know what Hospital Days was when I came down here. I'm like, what's this Hospital Days thing? And it's been part of my life for the last 16 years. I've been in the dunk booth every year. So
I think I jumped you a couple times.
Right. And to celebrate last year 100 years, Karen Jurheid, we helped author our book. I hope people have had a chance to see the 100 years of history, and it's really reflective of just the legacy of different providers, different community members, and the passion of the community. I really wanted to be in this seat through the 100th year, and the celebration. It was wonderful to do that last year.
It really, I mean, how many times do you go to see a surgeon, Dr. Eberle, saying, would you like a call for someone to get you home, Laura? I mean, it's been a gift to those of us who lived here. So, Bruce, we were speaking a little bit about the framework of how it's evolved, and I guess my big question is, we didn't really feel as residents the big changes that were going on until we realized we needed care for an orthopedic issue, and it was here. Was that important to you to bring providers here to our community? Yeah,
as I mentioned in an earlier segment, I think that my goal has always been there's 15 towns that I think is in my service area. There's 33,000 residents in this community, and from my standpoint, I'm a public health major background, both in BS and a master's, and so thinking about population health, having the community get the services that they can have rendered safely, high quality, cost effectively in their community is really important to me. There's always things that hitch, and then having the opportunities that if you have a high-end, tertiary need, that you have an academic medical center a half an hour up the road, which is actually now part of our system, right?
Which is
so
amazing.
it's a symbiotic relationship to sort of have the services that can be rendered locally done locally.
And as you pull those services into the community, you and I, as we approach retirement age, we've been able to take advantage of those.
I can tell you when I speak in the community to volunteers and to Rotary, how appreciative people are that they don't have to travel. I mean, I get it. I work in the medical center a lot, and getting up there, fighting your way through the parking lots, getting into the medical center, and it's just a whole different base. If you can have an academic provider, a tertiary provider, come to this community to lay hands on, why wouldn't that make the sense? That's the model I've been following.
Absolutely. More with Bruce King, who is President and CEO of New London Hospital, coming up next time here on YCN. I'm Laura James.